the Radium Girls. Famous for the ways in which they were betrayed by all manners of people in power. Their job was to plant glow-in-the-dark watches using paint that was, unbeknownst to them, radioactive. They were encouraged to use their lips to point the tip of the brushes to save money on paint that would otherwise be lost on a rag. The owners and scientists employed in the same plant took the necessary precautions to avoid exposure, all while hiding the danger from the ladies employed to paint the watches. They were told the paint was completely harmless. As the first of the girls started to see symptoms, doctors were paid off to hide these findings. And as the first of the girls started to die, they were told the causes of the ailments were most likely STDs like syphilis. This was in an attempt to besmirch the credibility of the frivolous girls. There's a long history of people in power causing human suffering for the working class, especially where they get the opportunity to work with for-profit healthcare. December 4th, earlier this month, CEO of United Healthcare, Brian Thompson, was shot and killed. United Healthcare, despite official records being legally hidden, has been accused of having the highest claim denial rate of all insurers available. Even recently being accused of using AI to automate claim denials. Though the truth of this seems very wishy-washy, and they deny using AI to completely handle claims. They deny using AI to completely handle claims. There is record going back as far as 2021 that they have tested algorithms for a prior authorization that sped up case handling. There are a bunch of numbers thrown about during a lawsuit back in 2023 that claimed the company knew of a 90% error rate and would have knew of a 90% error rate and had proceeded forward using it, knowing that on average only about 0.2% of customers would even appeal denied claims. Statistics is truly the most evil math. In the same lawsuit, UHC was accused of using AI to overturn patients' primary care physicians' decisions on medically necessary care in order to deny them coverage. The shooter is believed to be one Luigi Mangione, seemingly somewhere between politically motivated and seeking revenge. But we'll get into that later. It is worth noting that, albeit lengthy and often ineffective, a proper legal protest is preferred to the loss of someone's life. In some cases, such as this, it is also worth noting that there has been significant loss of life due to the actions of United Healthcare, or at the very least, the refusal of care that could have prolonged a life or created a higher quality of life. This was a murderer versus murderer confrontation. It's just one of them had the balls to do it the illegal way, with their own face. Lining one's bank accounts with profits built on the dead bodies of the working class should be defined as murder, and at the very least reined in by the law. The fact that it isn't is a huge flaw with a country where lobbying, bribery, is encouraged, and most, if not all, healthcare is privatized. Going forward, morality be damned, there is an inevitability that the working class will resort to violence if those with money continue to systematically fumble our efforts at being simply comfortable. No one needs $1 billion or $1 million. Just about $100 is enough for a normal person to eat a little better, and $100,000 keeps one alive for a year. Our bosses live nickel and diming our health for their luxury. Here in my script, I wanted to insert this poem by Tumblr user Insanity's Scribblings. The poor cried, "We are starving, there is no more bread, and we have nothing to eat." The rich man said, "Not my problem. You don't work for your bread, as if he did not snatch away the grain by his own greedy hands and create a filling bread for his own overflowing mouth. The poor cried, "We are dying, there is no more medicine, and we're all ill." The rich man said, "Not my problem. You don't take care of yourself." As if he did not buy all the medicine and raise prices so high the gods themselves would not be able to reach. The people stopped crying, and the rich man was satisfied. Until they came knocking at his door one night. Their faces were sunken, their flesh decaying. They were monsters of the rich man's own making. As they devoured his flesh, the rich man cried, "Please spare me." The ravenous zombies said, "Not our fault. You fattened yourself for the slaughter." Inspired by a famous quote by Frenchman Jean-Jacques Rousseau, "When the people shall have nothing more to eat, they will eat the rich." This monster, Luigi Mangione, has simply met his own Dr. Frankenstein. He's not an evil monster. Perhaps he's relatable. And I'm sure Book Talk will love this metaphor after you see how he looks. He was a Yale graduate who may have worked in very poetic ways. On the casings of the bullets he fired were etched the words, "Deny, defend, and depose," which mirror a saying, "Delay, deny, defend," which is a common mantra about commonly used tactics to avoid paying claims. The added word depose is defined as to forcibly remove from office. Then there is the 286 conspiracy, revolving around his X.com Twitter banner, which, as you can see, contains three things: the Pokemon Breloom, an X-ray of a back injury, and a very attractive photo of himself. The Pokemon Breloom is number 286 in the Pokédex, which has a very fun number of coincidences linked to that number. Denial code 286 is when a claim is rejected due to a late appeal. The McDonald's where he was apprehended was exactly 286 miles from the murder scene. He also had exactly 286 posts on Twitter. In the Bible, Proverbs 28:6 reads, "Better is a poor man who walks in his integrity than a rich man who is crooked in his ways." I love the living poetry surrounding this man. He also has a Goodreads account where he liked this quote from the Lorax that mirrors this proverb. "Unless someone like you cares a whole lot, nothing is going to get better. It's not." And on Amazon, he reviewed the Unabomber's Manifesto, where he remarked an interest with a quoted passage in the book that rambles about how violence is necessary and invokes fear in those in the industries where peaceful activism has failed. The whole quote, on an image I stole from an X thread with key lines highlighted, is on screen now. Somewhere over here. There are a few main theories as to what motivated Mr. Luigi. The injury pictured in his banner, two of his grandparents who both died in the healthcare system, or simply just being 26 years old, the age that most Americans are kicked off of their parents' insurance. Going forward, while rumors of things changing have been whispered about on Twitter, no hard evidence of change has been reported. It is, however, undeniable that healthcare providers are discussing these events, and hopefully this event will send ripples that change things for the better. And as of writing this script, a bill has hit Congress called the PBM, Patients Before Monopolies Act, that aims to end joint ownerships of PBMs, pharmacy benefit managers, and pharmacies. This joint ownership makes it easier for health conglomerates to overcharge for medicine. A pharmacy benefit manager is a middleman between insurers and pharmacies that do things like decide what medications are covered by your insurance, negotiating a price, and processing claims. A quote from a press release found on harshbarger.house.com: over the past decade, pharmacy benefit managers, the middleman between pharmacies and health insurance companies, have morphed into large healthcare conglomerates that exercise control over every link in the prescription drug coverage and delivery chain. Today, the largest healthcare conglomerate each owns a PBM, which pays for pharmacy services, as well as the pharmacy chains that provide those services. This inherent conflict of interest results in higher drug costs for patients and fewer independent pharmacies, but bigger profits for the corporate healthcare giants. End quote. Now, I forgot to put it in my script here, but I do want to say that while I was looking at this page, the Harshbarger house, the representative Harshbarger, I'm going to actually look up this link right now, Deanna Harshbarger, is also quoted as referring to herself as a lifelong pharmacist. So she might be one of those good politicians out there. Not that I'm saying that all of them are good, and I haven't done my research on that, but I like that. I like that. But she, as a pharmacist, is putting forward this bill. Anyways, in my honest opinion, the best thing that could happen is a deprivatization of healthcare and not have the lives of hardworking Americans be ended by for-profit healthcare. Followed close behind by the deprivatization of electricity and gas, because solar could handle everything, but that's a different episode. Not now. Using this channel, I'd like to support peace. I really would. But I can't help but admit that this whole situation gets my working class blood boiling with the passion for a better future. And clearly it got those who are still used to squishing us under their foot to realize that we do exist. This is a time for class consciousness. Please like, comment, and subscribe for more content like this. Thank you.